Hello and welcome to this week's episode of our Money Wisdom Questions series brought to you by Johnson Brunetti. My name is Ian Fergusson, Retirement Income Certified Professional and Financial Advisor here at the firm. This week's question: should I use an HSA in retirement? Well, first off, what is an HSA? HSA stands for Health Savings Account, and these are types of tax advantage accounts that you can put money into and benefit from a number of different tax advantages while you are working and enrolled in what is called a high deductible health plan. Now, how is an HSA tax advantage? Well, in three primary ways. Number one is the dollars you put into an HSA, you are given a tax deduction up to the annual contribution limits off of your income when you file your taxes come tax season. Number two is you could potentially benefit from tax-free growth of the money that's in that account, so long as you're using it upon withdrawal for appropriate expenses. Number three is exactly that. What is an appropriate expense? Well, qualifying medical expenses. When you pull money out of your HSA for a qualified medical expense, it is tax-free upon withdrawal. So should you be using this type of account in retirement? It really depends on your unique situation. These are conversations you absolutely need to have with your financial advisor if it's applicable to your situation. To answer the question generically, the first thing I would do is ask you, do you have an HSA currently? Well, because if you're no longer working and you're over the age of 65 and you're enrolled in Medicare, you are no longer able to actually open up an HSA and put money into one of these accounts. If you're still working, you're younger than 65 or even older than 65 but not fully enrolled in Medicare yet because of your employer healthcare benefits, you potentially could be putting money into an HSA and building up that account. So certainly an option you should explore. So how should you be using this money in these HSA accounts when you are retired? Well, in a multitude of different ways. So those monies that are in there, remember, are tax advantage because you can pull them out and benefit from tax-free withdrawals for using them for qualified medical expenses. You know, if you have money in that account when you retire and you're over 65, you're enrolled in Medicare, you could pay for a multitude of different healthcare costs using that money, and it'll be tax-free when you do so. Let's just say that you want to pull the money out and you're not going to use it for a qualified medical expense. You can do that as well. In the years leading up to your 65th birthday, you can do so, but the unfortunate side effect of that is that the money you pull out is added to your income, so you get taxed on it at ordinary income levels. And pre-65, there's an additional penalty on those withdrawals just for pulling the money out for a non-qualifying expense. After age 65, the money that comes out of those accounts for non-qualified medical expenses is still taxed at your ordinary income levels, very much the same way that an IRA withdrawal would be. But the additional penalty is removed after you're 65, you're enrolled in Medicare. So there's a number of different advantages to having an HSA, and using it appropriately upon retirement is certainly part of financial planning discussions that we have with our clients on a day-to-day, month-to-month, and year-to-year basis. Thank you for joining us this week for our Money Wisdom Questions series. Once again, my name is Ian Fergusson, Retirement Income Certified Professional and Financial Advisor here at Johnson Brunetti. If you like today's video, be sure to drop us a like and subscribe, and also please share this with a friend who you think could get some value from our awesome content. Thank you so much for joining us once again, and I look forward to seeing you next time.